about this topic. This is something that I have been very passionate about in my career, and I'm really excited to bring it to oncology nutrition. So a little overview of what we're going to be discussing tonight. So we'll talk a little bit about body image and cancer. I'm going to open up some questions about what health means to us, introduce you to health at every size. We're going to unpack some things about weight and health, and then use those ideas to move into using nutrition and movement to take care of yourself and promote body positivity. And of course, we're going to leave some time for questions at the end. So start thinking about those. Just a little bit about me so that you can see where I'm coming from on all of this. So like Rachel said, I'm one of the registered dietitians at the Perlmutter Cancer Center. I primarily work with the head and neck cancer population. I also work with some prostate cancer and melanoma services. Before I came to NYU, I worked inpatient at a different hospital system where I truly saw it all. I have worked with many different medical conditions. I also worked in the hospital during the peak of COVID in 2020, which is where this picture is taken. We were fortunate enough to receive some free pizza for healthcare workers, and I was struggling to negotiate the mask situation, which was new to us at the time. Big thing about me, though, is that I am not the food police. So many people, when I introduce myself as a dietitian or they come to meet with me, think that I'm going to be judging or policing what they eat. Far from it. We're not here to do that. Myself and my colleagues at the Cancer Center, we're here to help and support our patients eat optimally as they go through treatment and beyond. So some notes on some language that I am going to be using throughout the talk. I want to set us up here. The word diet. So the origins of the word diet is that it just means general way of eating. That is why the word diet is in my job title, dietitian. But we tend to think about diet as being restriction. I'm starting this diet tomorrow. I'm following
Stephanie?
that diet.
Stephanie, you're still on the first slide, the opening slide. I think you meant to advance it.
It's showing as advanced on my screen.
I'm still seeing the purple opening slide.
Oh no, you all missed the pizza picture of me.
We did, yes. We need to see the pizza picture.
Yes. Wait, sharing is paused.
Why do you want to try? Yeah, I was just going to say stop sharing.
I'm going to stop sharing and then
reshare.
Again. Sorry about that, everyone.
No, don't worry about it. It's okay.
Okay, so here we are. And then all right, what are you seeing now?
Okay, so I am seeing the first purple slide, and you're in like the slide sorter mode. So I see the ones on, I can see 2 and 3 underneath it. So I think you just need to, can you click on the one a little bit about me? Like if you double click it, will that allow you to?
I'm doing that now.
Let's see. Still on the first slide. I can try to share it on my screen if you want. Let me see. Just bear with us for one moment, everyone. Oh, wait, we can see the pizza.
Oh, thank goodness. I was so sad you were all missing the pizza. Okay, good. Okay, so now I just need to get this into slideshow mode, and I think we should be good. Okay, are we good?
Yes. Yep, perfect.
Okay,
thank you.
Great. Okay, so that's a picture of me with the pizza, having difficulty figuring out how to eat it with my mask. Okay, next slide. So I was talking about the word diet and how the origins of it is a general way of eating, but we tend to think of it as meaning restriction. And the reason that we do tend to think of the word diet as connotating restriction is because of diet culture. Diet culture is something I'm going to be talking about a bit tonight, so I kind of want to define it here. Diet culture is really the sea that we all swim in. We have all been affected by diet culture in some way, even if we have not followed a specific diet per se. Diet culture is the pervasive belief system that values appearance and body shape above physical well-being, psychological well-being, overall general well-being. Diet culture very much normalizes manipulating your body to achieve its ideals. This can take the form of food restriction, vigorous exercise, or even other methods like wearing restrictive clothing, such as Spanx or corsets back in the day, using airbrushing, manipulation tactics on our digital phones and computers. And so diet culture is something that I'm going to be coming back to a lot. The word obesity, I am going to avoid using it. The reason is that the origins of the word obesity are actually rather stigmatizing. I prefer to use more neutral language when describing bodies. So you're going to hear me refer to individuals in smaller bodies and individuals in larger bodies. You also may hear me use the word fat as a neutral descriptor. This has actually been accepted, and this word has been reclaimed by fat liberation movements. This next one is one that I actually still struggle with a little bit. It's always a journey. I'm going to be talking more about physical activity and movement versus using the word exercise. And I'm going to talk a little bit more about why later on, but just in case you notice that I'm kind of dancing around using the word exercise. And I just want to point out that Health at Every Size, or HAES, as it's abbreviated to, are registered trademarks of the Association for Size, Diversity, and Health, which is a not-for-profit and advocacy organization that does a lot of great work promoting these ideals we're going to talk about in a little bit. Okay, did this slide advance okay? All right.
Yes, it did. You're on the body image and cancer slide.
Perfect. Okay, glad we're on track. So I want to touch a little bit about body image and cancer, which is the reason we're here tonight. It's the reason to talk about these concepts. So cancer very much affects our relationships with our bodies. Studies have shown that body image disturbances occur in most cancer patients, especially patients who have to undergo surgeries, who have lasting wounds, scars, disfigurements. That may increase risk of body image disturbance. Cancer treatment can also cause decreased functionality. For example, many of my head and neck cancer patients lose their ability to eat normally as they undergo treatment. Many patients might experience fatigue and not be able to carry out their normal activities of daily living. That can certainly affect how they feel about their bodies. There are cancer treatments that may result in weight gain, cancer treatments that may result in weight loss, and in either direction, that can very much impact body image. And there's also a general feeling of betrayal that can come with a cancer diagnosis. I talk to many patients who they really, they question, I ate right, I did this, how did my body still betray me in this way? So a lot of complexities here. But working towards body acceptance is definitely a component of recovery. Learning to treat your body well and not being beholden to diet culture standards of what bodies should look like and how they should function. And I just want to point out too that the philosophies we're talking about tonight are effective for all. So even if you're not someone who has a cancer diagnosis or has undergone cancer treatment, I hope you can still get something from what we're going to be talking about here. So I want to open up this question. What is health? There's no one answer to this. Health can include many different things. I've listed 8 here. I'm not going to list off all of them, but I'll point out that nutrition and physical activity are only 2 of 8 things on this list. And there's probably so many more components of health that I don't even have listed out here. And I'll also just point out health is going to look different for everyone, for each individual. And health will change for all of us as we go through life. In different life stages, we'll have different priorities for our health. Certainly things like having children or getting a cancer diagnosis will change our priorities with our health. But we get this message in diet culture that health is very much tied to our weight. And it comes from all over: media, public health, pop culture. We often get told that your health depends on your weight. If you're thin, you're a healthy person. If you're fat, you're not healthy. And if you quite simply eat better, exercise more, you will be healthier. But it's so much more complex than that. So, what I want us to do is start thinking about how health is more than our weight. Health can't simply be reduced to diet and exercise. On the previous slide, there were only 2 out of 8 things. And health does not have a look to it. You cannot look at a person and know whether they are healthy or not. There's a lot of assumptions that get made about weight and health, though. And, I admit I have made many of these assumptions in my life. It takes a lot of unlearning to stop making these assumptions. When we make these assumptions, though, it can lead to us missing out on other factors. This can definitely have an impact on medical care. It's been well documented that individuals in higher body weights sometimes feel that um, that a medical diagnosis can be missed, or an intervention cannot be shared because the focus gets placed on weight instead of the actual medical issue. It can have an impact on social interactions when we anticipate judgment and assumptions from people. And it can lead to avoidance of both, unfortunately, which I would argue is unfortunate, because undergoing routine medical care and engaging in social situations are both very healthy things. So it's unfortunate when assumptions about weight and health get in the way of that. And one thing I want to point out is that these assumptions negatively impact everyone, regardless of your body size. To give a personal example, I am someone in a smaller body, and that does come with many unearned privileges. But this, I think, will illustrate my point a little bit. A couple years ago, I went to my primary care doctor and I asked her to check my hemoglobin A1C, which is a marker that can tell you whether you are at risk for diabetes or if you have diabetes. And she did not want to do it because of my body size. So that just goes to show how assumptions can happen both to individuals in larger bodies and individuals in smaller bodies as well. So I want to introduce us to health at every size, which is a paradigm that we can use to rethink health and our bodies. Health at every size supports individuals in adopting healthy habits for the sake of health and well-being versus controlling their weight. Health at every size encourages eating in a flexible manner that values pleasure and honors internal cues of hunger, satiety, and appetite. Finding joy in moving one's body and becoming more physically vital, and accepting and respecting the natural diversity of body shapes and sizes. There are many misconceptions out there about the health at every size paradigm. One I'm going to address is that it's called health at every size, not healthy at every size. Health at every size is not saying that everyone is healthy regardless of their weight, but that we all have the right to pursue health, whatever health means to us, regardless of our weight status. I actually saw someone on social media the other week. They tweeted, it should be called happy at every size, not health at every size. And I really like that concept, that we all have the right to pursue health and happiness without judgment or stigma. And health at every size promotes that our health is not solely determined by our weight. It recognizes that there's so much at play. Health at every size and body positivity are also not ignoring the importance of nutrition and physical activity, but rather separating those benefits from weight outcomes. I like this quote from a dietitian named Alex Caspero. She says, "I take HAES to mean that as long as you are healthy, it doesn't matter what size you are. but it doesn't mean you can be any size and always be healthy. And certainly that goes for individuals in larger bodies and individuals in smaller bodies as well. So let's address the elephant in the room here. Doesn't higher weight lead to chronic illness? So yes, there is a lot of research out there showing a correlation between higher body weights and chronic diseases such as diabetes, hypertension, heart disease, and including cancer. I want to unpack this a little bit. So first I'll point out that a lot of this research is what we call correlational research. And just to cover all of our bases, a correlation is when there's a connection between two or more things. Causation is the direct action of something causing something else to happen. So whenever we have correlational research, we need to unpack what else could be happening here that is causing this relationship between these two things. So in the case of higher body weights and chronic disease, there's definitely several other things that can be at play. One is chronic stress. It is very stressful to be in a larger body in our modern diet culture. We talked about all of the assumptions that can be made. You know, public spaces might not necessarily be designed for someone's body shape. You might not know if you can fit into a waiting room, restaurant chair, airplane. All of that stress can really add up. Socioeconomic status can also be a factor, which impacts access to food and to medical care. Medical avoidance. So we talked about the assumptions that can happen in the medical setting for individuals in larger body. And it's been well documented that weight stigma in the medical setting can lead to avoidance of routine medical care and therefore not catching things as early. Weight cycling is a very interesting one. So weight cycling is when you go on a restrictive diet, you lose some weight, and then because the diet is very restrictive and maybe not sustainable, ultimately the person experiences weight gain, and individuals can, yo-yo quite a bit with weight gain, weight loss, weight gain. And ultimately this cycling is associated with inflammation and insulin resistance. Interestingly, inflammation, insulin resistance have been identified as causations between higher body weights and cancer risk. And of course, there can be so much more going on depending on the individual. But the point I want to make here overall is that you can be in a smaller body and be metabolically unhealthy, meaning your blood sugar markers, your cardiovascular markers are out of whack. And you can also be in a larger body and be metabolically healthy. Both things can be true. But this correlation is out there. There is a lot of research saying this. So that begs the question, what do we do with it? And what I propose is that you think of weight as being a neutral risk factor, like gender or genetics. And then we provide interventions to reduce disease risk that are not weight loss. For instance, increasing diet quality, which has been shown to reduce risk of disease independent of weight status. Recommending physical activity and movement, decreasing risk behaviors. I gave a couple examples here to illustrate my point. So with cancer risk or recurrence, if we were to take a weight-focused approach and say, can you lose weight to reduce your risk? That would be a little bit confining. It's not very specific. So we can go more in detail and say, can you add more fruits and vegetables to your diet, increase your diet quality? And I'll point out that there's many beneficial nutrients and compounds in fruits and vegetables that have been shown to be protective against cancer. Can you decrease consumption of alcohol, work on quitting smoking, engaging in movement, decreasing stress? And then to take a more topical example from the last couple of years. So with COVID, when COVID first happened, a lot of research came out showing that higher body weights and their associated comorbidities led to increased risk of COVID. If we took a weight-focused approach to COVID and reducing risk, It would not be very effective because you need to be protected from COVID in the here and now. If weight loss happens, it would happen over a longer term. So instead, if we take a weight neutral approach to COVID, we would recommend things like wearing masks, socially distancing when needed, eating well to support your immune system, getting your vaccine when available. And I'll point out that when the vaccines first came out last year, individuals in higher body weights were prioritized to get the vaccine for ultimate protection. So you might be thinking, okay, this is all well and good, but what is the problem with recommending these interventions and also recommending weight loss? There can be several potential problems depending on the individual. Some of these might be more of an issue for one person and less of an issue for another person, but they're all kind of in the mix. So first, weight is not a behavior. It is not a concrete intervention that we can give someone. And there's no guaranteed outcomes. I think diet culture would have us believe that our bodies are bank accounts and that if you simply put the right amount of calories in with food and take out the right amount of calories with exercise, then you'll achieve, the perfect balance and meet diet culture standards. But our bodies are so much more complex than that. There's so much more that goes into our weight than just our movement and our eating. Our bodies are more chemistry labs, I like to say. So a few things that can impact our weight status include our genetics. Some people are just going to naturally be in larger bodies. Chronic diseases, of course, metabolism, which is something that changes as we go through life. Medications, and that can include certain cancer-related medications. Another issue with recommending weight loss is that it often promotes extreme dietary restrictions. It places the emphasis on diet quality versus quantity. It reduces our food to being about calories and not as much about being about vitamins, minerals, antioxidants, which all protect against cancer. And food is actually even so much more than nutrients. Food is comfort, food is culture, tradition. So when we put the emphasis on weight loss, we kind of strip away these other important elements of our diets. And there's many diets out there that will recommend, eating very low calorie foods, having bars and shakes and things that are not real food and not really satisfying to us. And that's not something that's necessarily going to be health promoting ultimately. Extreme dietary restrictions can also lead to psychological stress and anxiety, depending on the individual, and possibly result in disordered eating. Weight cycling, like I talked about before, and weight regain are also complications of recommending weight loss. Many people actually regain some weight within 5 years when weight loss for the sake of weight loss is pursued. And of course, when we recommend weight loss, as I've said, we can miss many other interventions. And one thing I want to point out too is that when we put too much emphasis on weight, we can also miss out on an individual's body composition. Lean muscle mass is something I talk a lot to my patients about. It has huge implications for our immunity, our wound healing, and muscle actually weighs more than fat. So sometimes, especially when we look at athletes or bodybuilders per se, weight can really be misconstrued in those populations. So ultimately, weight is one data point. It is a number on the scale. And when we put too much emphasis, we just miss out on so much else that is happening in a person's body and in a person's psyche as well. Okay, so now that we've talked about all of that, we're going to shift to how can we take care of ourselves without focusing too much on weight. So with nutrition, we want to switch up the mindset a little bit. I always say good nutrition is not about restriction. I think so often when people come to see me, they think I'm going to tell them to eliminate this food and that food. But I really like to think about nutrition as what can you add to your diet versus what do you have to remove from your diet. And we really want to focus on diet quality, as I talked about before, versus quantity. So one thing that diet culture really normalizes is this black and white thinking around food. And I think, we can recognize so many of these phrases. They've been so pervasive. So things like, I ate a cookie, I'm so bad. It's it's so funny how people come to see me and like they talk to me like they're in a confessional. But what you eat does not make you a good person or a bad person. There's no morality around food. So I recommend taking a more nuanced approach to thinking about the food you're eating. Think about, okay, I ate a cookie. It was satisfying. It tasted good. I had a salad because it's healthy. Believe it or not, as a dietitian, I don't love talking about foods as healthy or unhealthy because I think that takes a lot of nuance out of food and just categorizes it in a way that's maybe not necessarily fair. So instead of thinking about, having a salad because it was healthy, you had it because it sounded good. It was refreshing. The concept of cheat days, I feel like we can't cheat on our lifestyles. We have to, look at our days as being just a little bit more nuanced because, things are going to happen throughout the day. So think, okay, I'm going to make lunch at home. And then later I'm going out with my friends. I'll have pizza with them and I'm going to enjoy that. Feeling guilty because you had more food. Maybe you were just hungry, recognize that. And the concept of ruining your diet, flowing your diet. I'll point out one food, one meal does not make or break any diet. It does not make or break your health status. It's about overall how you're eating, how you're taking care of yourself. I want to dig into this concept of listening to your body. I feel like it's a very nebulous term that gets thrown around a lot. So let's unpack it a little bit. Listening to our bodies is something that we sort of lose the ability to do as we grow up in diet culture. If you think about babies, for instance, babies are very good at listening to their hunger cues. A baby will cry the second they're hungry, they go to feed, and they'll stop the second that they feel full. It's very uncomplicated. But as we grow up in diet culture, we get all of these messages about good foods, bad foods. I should eat at this time. I should do that. We lose our ability to listen to ourselves. So I think a big part of listening to our body is just simply honoring our hunger cues. I feel like these days I'm getting a lot of questions about intermittent fasting. And I guess one of the critiques I have about intermittent fasting is that it takes away this instinct to listen to your body. It gives you this kind of arbitrary set of rules to eat at these certain times when maybe you really need food outside of that window. So a lot of times we question when we get hungry, oh, can I put this off for a little bit? Why am I hungry now? But we want to allow ourselves to have food when we need it and avoid the starvation deprivation state. When you're so hungry, your blood sugar is running low, you're really irritable at everything, and you just kind of grab for the nearest thing. It's not a good way to treat your body. It's not a good place to be. So it's somewhere you want to try to avoid by honoring your hunger cues. Also, on the flip side, sometimes you just need to allow yourself to eat when your schedule allows you to. That's also part of listening to your body. For instance, if you were to have a meeting at 12 p.m. that goes till 2 p.m., I personally think that should not be allowed. But let's just say if you have that, maybe at 11:30, you think to yourself, okay, I'm not really hungry now, but maybe I just need to eat something because I know I'll be hungry in an hour or so. And in order to show up and be present and focus on this meeting, I just need to get some food into my system. That's okay too. And then part of listening to your body is thinking about what do you want to eat in this moment? Things like what kind of taste do you want to go for? Are you in the mood for something a little bit sweet, a little bit more sour or savory? What kind of texture do you feel like? Do you want something crunchy? Maybe something more chewy or maybe more liquid like soup? What temperature? It's something that, we're all very much affected by with seasons. General preferences. What do I actually like to eat? I think that's something that we so often question and we so often lose sight of. How a food makes you feel. Do you want something that's going to be comforting? Maybe after a long day, you want something like a soup or a grilled cheese sandwich that's going to, remind you of something your grandmother made. Or do you want something more refreshing, like on a hot day, you have a nice smoothie? And of course, honoring your medical needs is a big part of listening to your body. If you have an allergy or intolerance, and working with side effects from cancer treatment. So many of my head and neck cancer patients, for instance, might need to have softer foods as they go through treatment. Some patients might experience stomach problems as they're going through treatment, and they know that part of listening to their body is having something that's going to be a little bit more bland and easily digestible. So allowing yourself the flexibility to work with that. And it's interesting, a lot of times when I talk to patients about modifying their diet for treatment, they say, oh, but I didn't think that food was healthy. Well, what's healthy for us at one point might not be the thing that's healthy for us at another point. So maybe having a salad is something that worked for a patient before treatment, but when their stomach is upset in the middle of treatment, a salad might not be the best thing for them in that moment. And going for satisfaction with our meals and our snacks. I guess this is also a big part of why, I don't recommend, a lot of caloric restriction, or I should say restrictive diets, because a lot of times they promote eating in a way that's very unsatisfying by eliminating whole food groups. So to make our meals and snacks satisfying, we want to try to include a mix of the following things. So carbohydrates. Carbohydrates have gotten a bad rep in recent years, but carbohydrates are the energy that our cells need to function. We get carbohydrates from a variety of foods, including our fruit, rice, bread, pasta, cereal, potatoes. I spent a very long time defending potatoes to people. People get very nervous about the starch content of them, but potatoes are a wonderful food to have that give us a lot of good nutrients. Fiber is a form of carbohydrate that our body is not able to digest. So it does a number of good things for us, including helping to keep us filled up and satisfied, promotes bowel regularity, gut health, helps to regulate cholesterol. And we get fiber from a variety of foods, including our fruits, vegetables, beans, whole grains, nuts, seeds. Protein also does a number of wonderful things in our body, which we get from animal sources like chicken, fish, eggs, plant-based sources like tofu, beans, and dairy sources like Greek yogurt, cottage cheese also, which I don't have listed on here. Dietary fats, they got a pretty bad rep in the 90s with the whole low fat and SnackWell's craze, but I feel like they've made a little bit of a comeback. Dietary fats are concentrated sources of energy. And there's ones that are particularly good for our heart, like nuts, nut butters, seeds, avocado, fatty fish, olive oil. So you want to try to aim to get a little bit of these in meals and snacks, but also recognize that this is just a guide. It's okay if you don't wind up having everything in every single meal. It doesn't mean that you won't be satisfied. Think about having an ice cream cone. That doesn't include all of these components, but it's still a very satisfying dessert to have. And I guess an example that I can give to kind of illustrate this point a little bit is if you think about a salad, people often think of a salad as being kind of like a low calorie, very empty food. It can be if you're just having some lettuce, tomato, cucumber, little vinegar on it. But if you then add chicken for protein, you add some quinoa for good carbohydrate, a little bit of fiber, you add avocado and olive oil for salad dressing for some good fats, then that salad can become a very satisfying meal. And of course, during treatment, many patients might have to make some adjustments here. Not all of these are going to benefit every patient, depending on what side effects they're getting. For instance, patients who are having stomach upset might need to decrease the amount of fiber they're eating. Some of my head and neck cancer patients, I actually really recommend that they eat more dietary fat to get in that concentrated energy when eating becomes difficult. I also want to touch on cravings a little bit and normalizing them. Because I think when I talk about letting go of some of diet culture's rules, being a little bit less restrictive with yourself, people worry, okay, if I let go of some of these food rules, aren't I just going to go crazy and eat pizza and ice cream all the time? So cravings are going to happen for all sorts of foods, and you have permission to honor them. Depriving yourself of a craving is only going to make you want that food more. It might kind of rebound against you in the end. So if you think about what would happen if someone told you that you couldn't have your favorite food again. Actually, let's even make that more specific. If you could not have your favorite food again for the next week, for me, this food is ice cream. Ice cream would be on my mind all week long. I would just put ice cream on a pedestal and think about that moment when I could finally have ice cream again. But on the flip side, what would happen if I ate nothing but ice cream for 3 days? I put pizza in the slide, but for me, my example is ice cream. By the end of those 3 days, my body would rebound from that a little bit. My body would say, okay, time for something else. We naturally are going to crave a variety of foods. And our bodies are pretty good at letting us know when something is not working for us anymore. So I just encourage you to be mindful, but not just mental about the foods you're craving. Try to unpack it a little bit when you find yourself, maybe putting a food on a pedestal a little bit. Think about why you want the food. Is it because you saw it on TV or because you've really deprived yourself of it? And when you're honoring your cravings, ask if you're doing so appropriately. With my ice cream example, for a really long time in my life, I would buy those low calorie ice creams that you might see at the grocery store, and I would just keep thinking about wanting real ice cream. In retrospect, I would have been much better off just having a little bit of real ice cream and moving on with my day. Another really important element of taking care of ourselves with nutrition is stepping away from food comparisons. Food comparisons can happen both in person and really can play out on social media these days too. There's a lot of like what I eat in a day videos out there, things that can really inspire comparison to people that you might or might not know. But you have to recognize that everyone has different nutrition needs. Your level of hunger is going to be different than the next person's level of hunger. And you don't know everything about a person based on what they eat. I know personally, I've been in a situation where, say, I'm out to lunch or dinner with a friend and I'm eating a lot more than them, and I feel subconscious about it. I think, what's wrong with me? I'm eating so much. They're so disciplined. They're not eating anything. But there can be so much happening with a person. Maybe they're having a stomach bug that day. Maybe they just ate an hour before and didn't want to tell you. And maybe none of those things are happening, and that's okay. There's no morality in food choices or the amount of food that you consume. If you eat more than your friend, your family member, it doesn't make them any more virtuous, any more disciplined, because we all have different levels of hunger that we need to honor. So moving into movement and physical activity, because it's a very important component of cancer treatment and survivorship. Physical activity does not necessarily need to be structured or regimented. That's why I really try to refer to it as movement or physical activity instead of saying exercise, which has that connotation of being really regimented. And we want to try to separate the benefits of doing movement from weight loss and not just make it about burning calories. There are so many non-weight benefits of physical activity. I'm not going to read through the entire list. One I'll highlight is preserving lean body mass during cancer treatment, which is something that I talk to patients a lot about. Also, bowel regularity is something I talk to patients a lot about. Doing light exercise can be really helpful with that. So, in terms of what movement you should do, it's going to be up to you and also possibly up to your treatment team if need be, if there's any concerns. But just some questions you can ask yourself when you're trying to decide what movement to do. What do you actually like to do? I think so often, just like I was saying with food, so often we don't actually think about what we actually like or what we actually enjoy. What would feel good to you on that particular day? Do you want to do something that's going to make you feel strong and powerful? Or do you want to put on some good music and get your heart rate up a little bit? What do you have time for? So I feel like so often there's this all or nothing mentality with physical activity that if I don't have a full hour to do it, it doesn't count. But if you have 5 minutes, 10 minutes, 3 minutes, 7 minutes, you can still get benefits from doing an activity. Do you have something you want to achieve that day? Do you have injuries or limitations that you need to honor, which can definitely be things associated with treatment as well? And here we just have some ideas of different things that, we can consider to be movement or physical activity. It's not simply, going to the gym and hopping on the elliptical for a certain amount of time. So now that we've talked a little bit about changing our mindset on nutrition and physical activity, I want to move into talking a bit about body positivity. So the origins of body positivity are from our social movement to empower individuals no matter their weight or size. It's rooted in the fat acceptance movement of the 1960s. And this talk is not associated with any official movement, but rather we're talking about body positivity in the general sense of the term and feeling good and confident in your own skin. So what does body positivity look like? It actually does not look like any one thing. Body positivity, it's not linear. Achieving body positivity or I shouldn't say achieving, the process of working towards body positivity can be very one step forward, two steps back. And it's not something that happens overnight. It really takes a while for all of us to work towards feeling positive in our bodies, in the diet culture we live in, with the expectations and the ideals that get communicated to us every day. And of course, it's going to be different for everyone. And there's a lot of barriers towards achieving body positivity. Definitely the cultural ideas surrounding beauty that we get that are very much communicated to us in media in really subtle ways we don't even think about, like when we look at advertisements, stock images. Of course, lack of size acceptance. If you're in a body that is not societally accepted, that can make it even more difficult to work towards body positivity. And this is something that affects all genders. Certainly having a disability or a physical limitation can make it more challenging. And like we talked about earlier, changes that patients undergo during cancer treatment can be a huge barrier towards achieving body positivity. So I want to introduce this concept of body neutrality, which I think can be really useful. Body neutrality is just existing peacefully in your body. You devote less time to thinking about your body, recognizing that focusing on other elements of yourself and recognizing that your body is not the most interesting thing about you. I like this quote from the actress Jamila Jamil, who's been a big advocate in this space. She says, "Imagine just not thinking about your body. You're not hating it, you're not loving it. You're a floating head. I'm a floating head wandering through the world." I kind of like that visual. So we want to think about how we can show respect and appreciation to our bodies and recognize that your body is not something that is to be feared and manipulated like diet culture has taught us, but rather respected. And think about your body's worth outside of diet culture. Even if you have scars, wounds, the things that you persevered through, and getting those, that means, those experiences are worth so much that diet culture does not recognize. And think about how you can honor your body on a day-to-day basis, using food and activity like we talked about. But there's also so much that was beyond the scope of this talk tonight, other mindfulness activities, intellectual pursuits, or even just rest. Sometimes sleeping is simply the best way to honor your body. And take a moment to notice things that your body is able to do, like breathing. A lot of times we take that for granted. To tell a personal story, during the peak of COVID in spring 2020, when I was working inpatient, I came home one day feeling very stressed and overwhelmed by everything that was happening. So I put on a yoga video to do in my apartment. And yoga is very much about linking breath and movement. So big emphasis on breath. And as I was going through the yoga class, I just suddenly had this realization of I can breathe on my own. This whole health crisis is happening right now because our patients can't breathe on their own. They require machines to do that for them. But right now, I'm able to breathe on my own, and that's amazing that I can do that. Then eating, I feel like sometimes just gets so demonized in diet culture, but it's amazing that our bodies are able to do that. And this is something I really think a lot about when I work with my head and neck cancer patients who have trouble with eating, or I work with many patients who require having a feeding tube placed to get their nutrition. So, the fact that if your body is able to chew, swallow, digest, and metabolize food normally, I think that's pretty incredible, and we should all recognize that. The movement you're able to do on a day-to-day basis, things that even if it's limited, just recognizing the things that you're able to do. And of course, one's ability to manage cancer treatment, of course. I want to touch a little bit on navigating the medical system, because I think what we talk about here is all well and good, but then you go back out into the world and how can you bring these concepts? One thing I'm going to point out is I did talk a little earlier about assumptions that get made in the healthcare setting and medical weight stigma. I want to make it clear that there are inherent flaws in our system, and primarily insurance companies that overuse BMI. I don't blame any healthcare provider for this. We're all working in a very difficult system that unfortunately places overemphasis on weight. There are some in body positive spaces that would advocate for not being weighed at the doctor's office. I will say in an oncology setting, there are reasons that your weight should be known. One is we want to monitor for any drastic changes. With some cancers, patients know something is wrong when they start losing weight drastically. Also, medication dosing. If you're receiving chemotherapy, if you're undergoing a procedure that requires anesthesia, you want your precise weight to be known so that your medications can be dosed accordingly. There are options for being weighed, though. If you don't think that knowing the number on the scale will serve you, you can always ask for a blind weight. That's where you step on the scale backwards, and hopefully the person taking your weight should not state out loud what it is. And also you can ask if you feel like weight is being overemphasized in your diagnosis, in your interventions. You can ask for an intervention that has nothing to do with weight. And remember that your medical team works for you. There should always be an open dialogue about these issues. So just some closing thoughts, think about how can you use the ideas we talked about tonight to improve your relationship with food and your body. Maybe think about 1 to 3 ways you're already doing this, and then think about 1 to 3 things that you can start incorporating, some adjustments that you can make. Ultimately, our goal is, for everyone to work towards being healthier, whatever that means for them. And just some resources. So if you want to learn more about health at every size, I recommend visiting the ASDO website. I've included that here, and a couple reputable resources for nutrition information pertaining to cancer treatment, AICR, National Institutes of Health. The internet can be very tricky and very challenging when it comes to information about nutrition. So I always like to provide some reputable places to go. And of course, if you are interested in talking to one of our dietitians at the Perlmutter Cancer Center, if you follow with a physician, you can ask for a referral. And I think we have hit the question part.
Stephanie, thank you so much. That was great and so informative. I really like your well-balanced approach, and it's nice that you're not the food police. That's always great to hear. And I really liked your point about food comparisons, especially with social media. And I feel like every time I log on to social media, the first thing that pops up is what I eat in a day. So that was all very relatable. And I also just wanted to read one comment, a very nice comment from a participant who said, "I'm loving this refreshing approach to the topic of nutrition." And I agree with her. So
great.
before we finish up, does anyone have any final questions? Last call for questions.
I will say, even as a dietitian, I go on social media and I see those things and I start thinking about them like, Steph, you have a degree in this. Like, you know that this is not real life. So it's challenging for all of us out there. So I really hope that the concepts we talked about tonight can help everyone navigate that a little bit.
Definitely. Well, Stephanie, thank you. That was so incredibly helpful. And we really appreciate you taking the time out of your busy schedule to be here tonight. And thank you to everyone for tuning in. We'll see you next time. Thank you again, Stephanie.
Of course. Thank you.
Okay. Good night, everybody.
Bye.
Bye.